Hi, I'm Bill Palma from Grid City Fire and EMS Training. So, you're interested in EMS. The reason why I know that is because you're watching this video. Odds are you just started EMT class. So, we're going to talk today about Chapter 1. And it doesn't matter what EMT book you're using, Chapter 1 is pretty much always going to be the same. Chapter 1 talks about who we are and where we came from. EMS didn't just appear instantaneously. There has been a progression in the United States to get us to where we are. Modern EMS as we know it is part of a continuum of care. That care begins the moment somebody activates the 911 system. The 911 dispatchers are the beginning of this continuum of care. They can provide a lot of information to people when they call about how they can start caring for somebody while they're waiting for us to get there. EMS then is activated, and there are many different forms of what that system looks like that gets activated. And so some of what we're going to cover today are the different types of EMS systems that are out there. It is very different sometimes, depending on where you live, what type of an EMS system your community has. And so we're going to get into what that looks like and some of the different versions of that. That continuum of care, we are a big part of it. We are taking care of our patients on the scenes, and we are taking care of our patients while we transport them to a hospital where that care then continues. You can trace back kind of the beginnings of what we know now as modern EMS to the 1960s. Before that, there was not much, if any, care being administered to people before they got to a hospital. Now, there was ambulances per se, but they were just pretty much glorified taxis. And I know some people may say we kind of still are, but it really was like that back then. You essentially were going to get a ride to the hospital. One of the biggest things that has happened that proved the need for care before the hospital was what happened during war. When you look at, and they did look at, the Korean War, the Vietnam War, it painted a picture where it was pretty obvious that those that got some type of care before getting to the field hospitals did better. And a lot of that had to do with things like bleeding control, treating for shock. And we hold those things to this day as core fundamental things that we do in EMS. But that's where a lot of this originated from. A lot of our care for our traumatically injured patients originated on the battlefield. In the 1960s, one of the things that they started to realize was that we had way too many people dying from vehicle accidents. Now, a lot of that was a combination of things. There weren't many safety things in vehicles, but also these people were not getting any pre-hospital care at all. One of the things that also happened with some of these things that came out in the 1960s were they created a state by state type of approach to handling this. And what they did was they kind of commissioned each state to come up with their own version of an entity to kind of oversee how to make this better. Once we got into the 1970s, some of that stuff had started to already play out, and they realized that they needed to come up with some funding to actually get people trained on how to take care of people, both from traumatic incidents and also from medical events, which there is a difference in our minds sometimes about those two types of patients. And so funding in the 1970s became a thing. They also did more research. You started to see actually papers being written about what was working and what wasn't. And that kind of led to the creation of a lot of the organizations that we know today. Things like the National Registry of EMTs. The very first paramedic programs blossomed from this. EMT training, which is what you're taking now, is kind of the beginning step of emergency responding training. There is a level below EMT, which we'll talk about here shortly, but most folks, when they get into EMS, start at the EMT level. Paramedics are a level above EMT, and in the 1970s, that's where the paramedic was born. That is the highest level of care you can get pre-hospitally, and with those paramedics came an increase in the type of equipment that we would see on what they would now look at as an ambulance, funding, uh, the fire departments getting involved with running emergency medical services all kind of came together in this time frame. Um, we started to kind of grow by leaps and bounds with our abilities and the things we were able to do. Through the 80s, 90s, and into the 2000s, we slowly turned into what we are today. There were huge advancements, especially on the medical side of treating patients with heart attacks and respiratory issues, and new equipment has come into the fold. These advancements have made ambulances extensions of the emergency room. We can do so much now that they would be doing in the emergency room that we are now a true extension. So now let's talk a little bit about access to the modern day version of EMS. And most people in this country access EMS through the 911 system. That system is relatively young also. That system of 911 originated in the 1980s. And before that, if you needed emergency medical service or the police or fire, you had to dial out a complete phone number. And in some communities, maybe dial zero to get an operator. But with the advent of 911, it kind of centralized the platform to get help. With the modern day version of this, 911 has taken on a couple of different models. You've got your enhanced 911, which is where they have the ability to know information about you before even answering that call. When you call in, your name, phone number, address all come up on the screen. The problem with this system that we're working our way through, even to this day, is people using cell phones now. And so you can just imagine if you call in from a cell phone, even if the name and the phone number pop up, your location is relative to where you are and not your physical address. And we have a lot of people who are on someone else's cell phone plan, and the person whose name is on that plan, generally speaking, is the one his name is going to come up on that 911 center for enhanced 911. Now, the second phase of enhancement with this allows us to use GPS and tracking to pinpoint cell phone locations that are activating 911. And so that's another step. We're also moving towards some different ways of getting people to call 911 through texting and through some other means. They have always had a system where they could help out people with disabilities get in contact with 911. The TDDY system in that kind of allows a typing type of system for those folks that maybe are hearing impaired. But the way that the 911 system works is when you call into it, you are routed off of either a cell phone tower or through a landline to what's called a PSAP. That's a public safety answering point. That is the initial call taker of the 911 call. They're then able to take that information and figure out who they need to transfer you to, if needed, to whether it's a different jurisdiction or also deciding, do you need EMS? Do you need police? Do you need fire? Once that call gets to its destination, after possibly being rerouted through that public safety answering point, then a local dispatcher generally is going to take over. And in EMS, we want that dispatcher to be emergency medical dispatching trained. They're then going to take that and they're going to dispatch the necessary resources to get there. So now let's talk about different types of EMS systems because like I said earlier, depending upon where you live at or where you're at, your access to 911 EMS specifically could be very different. So the first type of system we're going to talk about is the fire-based EMS system. In the fire-based EMS system, the fire department runs EMS. They run ambulances and a combination of ambulances and fire trucks with trained personnel on them. This system is how the majority of the country is covered by 911 for EMS at this point. Another type of system is the municipal system. And that kind of sounds similar to the fire-based EMS system. But what a municipal system is it separates EMS into a separate service, but is still done by the city or the township or whatever the authority having jurisdiction is. In this model, you have your fire department, your police department, and then your EMS department. This is also a popular system, especially for some of the bigger cities that run EMS. Another very popular system that's run across the country is the private EMS model. And this is where you have a private ambulance company that is contracted with a municipality to do the EMS service for them. Now, that doesn't mean that the fire department is not going to be involved in that. In a lot of these systems, the private ambulance company does the transporting of the patient. The fire department does still send fire trucks on some or all medical calls in order to get some responders there more quickly. It is proven that the fire department gets the calls faster. Fire stations are spread out in a manner that is perfect for getting resources to areas of the city very quickly. And so this model where you have the private and the fire department responding is a very popular model as well. Another form of an EMS system is a hospital-based system. Now, a hospital-based system is where the EMS for that area is done through a hospital-based ambulance. That means that that ambulance is owned and operated by the hospital or the hospital system. And that means that they are providing all of the EMTs and paramedics on that ambulance, and that they are the ones that are responsible for doing the EMS for the community. It's similar to the private model, although this is just specifically done by the hospital. We don't see a whole lot of that, but we do see hospitals playing a role in EMS. Locally, where I live and work, our main hospital in town, they run a mobile intensive unit that is EMS staffed. It's primarily done for interfacility type transports, but they do come out sometimes on larger scale events to assist, especially hazmat incidents and things like that. So there are some other areas of the country where this is more of a bigger model, especially for maybe localized neighborhoods and things like that. But you don't see it as much as some of the other systems. Another model is the law enforcement EMS model. You don't see this very often where law enforcement takes a central type of a role in EMS care. You do see a lot of law enforcement entities participate in some of the EMS care, but a true law enforcement system that runs EMS is not something you see very often. We have many different teams that sometimes make up a combination of law enforcement people, EMS people, fire people. SWAT paramedics are a big thing in the country right now. That generally is going to be a combination of maybe fire-based EMS with the law enforcement. Also, there are some areas where they do run aeromedical or helicopter EMS using law enforcement as the tool to do that. So that is something that you might possibly see. There is also something called a public safety officer. This is a wear all hats kind of a trained person where that person is trained in law enforcement, fire, and EMS. This is not a very common model, although there are some places where it is utilized out there, maybe because of a lack of resources, a lack of manpower, where they have to combine some people's roles together. So let's talk levels of training and levels of certification in EMS. So the very bottom tier of EMS training is the EMR, or the Emergency Medical Responder. This level of training does not allow you to work in the back of an ambulance. This level of training is primarily designed for volunteer fire departments that need to get some people some training on very basic life-saving skills. They are designed for those communities to use those folks, maybe running on a fire truck as a volunteer or in a non-transporting style. You cannot work in the back of an ambulance with that EMR designation. The next level up is the EMT, which is the class you're in right now. EMT is the entry level to work in the back of an ambulance. EMT stands for Emergency Medical Technician, and there is a whole range of skills that are included with EMT. They are able to do a lot of the things that are the truly life-saving skills, things like bleeding control, things like good CPR, things like treating chest pain patients with medications and with running 12 lead EKGs and things like that. We put a lot onto our EMTs nowadays, but it is the entry level in terms of getting into working on an ambulance. The next level up is the EMT Advanced or Advanced EMT. This level is where you separate from the basic life-saving skills of the EMT into a lot more of the advanced life-saving skills. In fact, we designate the EMT role as a BLS unit. BLS is that designation of basic life support, and then we use ALS to refer to the EMT Advanced and the paramedic. But let's talk EMT Advanced for a bit. They have to become an EMT first, and then they could take extra training to become an EMT Advanced. This training allows them to give a lot more medications. It also allows them to start IVs and allows them to do some extra skills. This is one of those kind of gray areas of certification that you do not have to hold if you do want to become a paramedic. If you are an EMT and you want to become a paramedic, you do not have to become an EMT Advanced first. You can go straight from EMT to paramedic. Paramedic is the highest level of EMS care and the highest level of certification that you can have in EMS. There are some calls that the paramedic makes the difference. That set of skills are absolutely needed for a certain set of calls. There are other calls that the EMT is perfectly capable of handling. What we need to have out there is a good way to manage which patients get the level of care that they need. And so that's something that we're continuously working through. So EMS's role is to deliver what's called pre-hospital care. We are pre-hospital care providers. Hospitals have their role too. And one of the things that you have to understand is that not all hospitals are created equal. There is a wide range of abilities that one hospital has that another may not. And so when you learn and you become an EMT and you're making decisions about where patients need to go, you have got to take all of this into consideration. There are certain hospitals that are trauma centers. These are hospitals that are very specific that can handle those patients that are injured. Trauma is a term we use for patients that have injuries. Medical is a term that we use for patients that have illnesses. We kind of distinguish the two, although you can have patients that have both. You'll see that as we go. But trauma centers are a big one. If you have somebody that's been involved in a vehicle accident or a fall from a roof or some type of a significant trauma injury, those patients are going to need to go to a trauma center. Now, you also have some hospitals that are considered burn centers where significant burn patients need to go. You've got cardiac centers, you have stroke centers, and these are places that are designated to take care of those kind of patients. You also have pediatric hospitals. You've got hospitals that have psychiatric services in them, hospitals that have OB or the ability to deliver babies. Not all hospitals do. What ends up happening when you take a patient to one of these facilities that should not be going to that facility, or they go in by car, is that they have just bought themselves another ambulance ride or even possibly a helicopter ride to the correct facility. So one of the big responsibilities as an EMT is to know in your area which hospitals can handle what. So let's talk about what some roles and responsibilities of an EMT are. You know, if you watch TV and you see these shows about EMS, you probably think that the whole day is just driving around, saving lives, being a hero. There's a lot more to it than that. So let's break a call down so we can see and talk about what those roles and responsibilities are from the beginning. First and foremost, those responsibilities begin before you even get a call. The responsibilities and role of an EMT are to be a good employee, to arrive to work on time, in uniform, looking neat and presentable, putting on a good appearance. It's coming in and it's getting some things done when you get to work. We have a role of checking our equipment to make sure that the equipment is all there and in working order. We have to check our vehicle to make sure the vehicle is in working order, that you have fuel, that there is no mechanical issues with it, that the headlights are working, and more and more and more. We also have to make sure that we take care of any duties that we might have around the station, whether that's cleaning up, taking care of things. Um, that is a whole side of this that you don't think about when you get into it, station life. And that's part of our roles and responsibilities. The next thing we'll talk about is going to the call. A lot of people don't think about this part of it, but we have to drive the ambulance. So, driving with lights and sirens, driving without lights and sirens. This is a very dangerous part of what we do. One of our roles is to do this safely with due regard for the public. Once we arrive at the scene, the role shifts to a caretaking role. Some of our duties then are going to be to do a full assessment on these patients, which you're going to learn how to do in here. You have to do an assessment so you can find out what is wrong, find out whether it's an illness or an injury, find out what those injuries are or what their signs and symptoms are, and then treat accordingly. The next is deciding where to go, which hospital are we going to go to, safely moving your patient. So lifting and moving of our patients is a responsibility that we have to get good at and know what's available as far as equipment to help us with that, and also what our limits are. Then transporting to the hospital, providing care while transporting. It's not as easy as it sounds. Doing patient care in the back of a moving ambulance, especially when you get into the higher levels, when you're potentially starting IVs and stuff like that, can be a bit difficult, but that is also one of our roles and responsibilities. Communication is another one. Whether you're communicating with other responders at the scene, communicating with your fellow employees, communicating when you call in your report to the hospital about your patient and how they're doing. When we get to the hospital, we have to give a verbal report to the hospital staff about our patient, what they called for, how they were doing, what we've done, and if there's been any changes. All of that has to be given through good communication. Once that is finished and we've moved our patient over and we've given our report, we have to do a written report for that run. We have to do a computer report for that run. So that's another role and responsibility. Getting the ambulance put back together, getting everything cleaned up and sanitized and ready for the next call, and then getting ourselves back into service in a timely fashion to be ready to keep doing it all over again. These are just some of the generic roles and responsibilities. As we get through all these chapters in this book, you're going to see that expand into what all those different pieces look like. It's a lot. So let's talk real quick about appearance and how you present yourself. As an EMT, you represent quite a few different entities. You represent the company you work for or the fire department you work for. You represent your community. You represent wherever you went to school at to become an EMT. And most importantly, you represent yourself and your family. The physical demands of this job are a lot. And that's another thing that some people don't realize when they get into this is just how physically demanding this job is. If you run 4 calls during the day and those 4 calls have patients that are on the second floor, those are 4 calls where you're going to potentially have to carry somebody down at least 1 flight of stairs. You're going to be putting the cot into and out of the ambulance multiple times with people on them. You're going to have to carry people possibly across distances. You're going to have to pick people up from the floor. You're going to have to move people out of areas that are very difficult to get into. Not everybody gets sick or injured in the most perfect place. you're going to be needing to get grandma out from being wedged between the toilet and the wall at some point. I promise you that. And so the physical demands are numerous. With that being said, we have got to take an active role in making sure that we are physically able to do this job. It takes strength, it takes coordination, it takes practice. Learning how to lift properly, that's an absolute with this job. Now, I'd be a liar to tell you that you're going to be able to lift properly every time you do lift something. It's impossible in this job. It's too dynamic. The way we have to pull people out of certain areas or move things around. But when you get the opportunity to lift correctly, you need to take advantage of it. So, what kind of skills are you going to bring to the table when you learn how to become an EMT? Well, you're going to learn a lot in these next few months. You're going to learn how to use all of the equipment, which you have to keep practicing to get masterful at. You're going to learn how to clean things and disinfect things. You're going to learn how to give medications. You're going to learn how to do procedures that take skill. One of the things that you have to accept in this line of work is that the details matter. It's not just that you do something, it's how you do it. You have got to do all of the details right. So, what type of personality traits make a good EMT? Well, you have to be able to work good under pressure. That's for sure. But there are other things. We want people that have integrity. I like to define integrity as, somebody that does the right thing even when no one else is looking. We need to be trustworthy. You need to have empathy. Empathy is not the same as compassion. Compassion is our thoughts towards another or our feelings towards another. Empathy is us kind of putting ourselves into their shoes. People that make good judgments, people with good character, people that can think outside the box and that are flexible to change. That is a big part of what we do. It's never cut and dry. It's always going to be the same way. We are constantly in a state of having to adjust what we're doing for the circumstances. So the more flexible you are, the more you are a good problem solver, think outside the box type of a person, creative, the better you will do at this job, for sure. You've got to play well with others too. You got to be a good teammate. This is a job that is a team sport, hands down. You've got to be able to communicate well with others, work well with others, and get on the same page. You also have to be a good listener. I had a problem with this when I got into this line of work. I have to actively listen. If I don't, people talk and I don't hear a damn thing. And so I've had to work at that because, especially when you're doing an assessment on a patient and you're trying to figure out what's wrong with them, what they're telling you is really important. You can't be thinking about what you're going to say next while you're trying to listen. So if you think you're a person that struggles a bit with this, work on active listening, where you're really focusing on listening and making it a priority in what you're doing. So now let's talk about how this is all put together. There are a lot of different agencies that oversee EMS. Now, what the government has done is they've pretty much allowed each state to have the main influence on how EMS in their state is done. And so authority rests for the most part with the state agency. Now, federally or nationally, EMS is under the umbrella of the National Transportation Department, which is kind of wild. And that department is usually dealing with things like regulating taxis and trucking and things like that. But EMS has been plugged into that early into its existence, and we've never got out of it. But at the state level, each state has their division of EMS or whatever they call it that's tasked with coming up with how that state is going to do their certification for EMTs, what is required to maintain that certification, what is required if somebody comes from another state, maybe with another state certification. Now, the National Registry of Emergency Medical Technicians is a national organization that does most of the written testing for the states. In fact, in 48 of the 50 states, the National Registry is the organization that puts on the written test for you to become an EMT. Now, the second part of that testing is skills testing. That is left up to the individual states to figure out how they want to do that. And so, in order to become an EMT in each state, you have to go through the process of the written test given by the National Registry, and then whatever it is your state testing is for the skills. Now, remember, that's only in 48 out of the 50 states. The other two states do their own version of a written test and not the National Registry. One of the things that each state organization also does is it comes up with what the scope of practice is in that state for each of the EMS certifications. What that means is at the EMT level, here's what you're allowed to do in this state. At the EMT advanced level, here's what you're allowed to do in this state. At the paramedic level, here's what you're allowed to do in this state. Now, those that scope of practice does not translate into locally what you're actually going to be able to do. It is just the broad statement that in this state, here's what we allow an EMT advanced, or a paramedic to do. Now, what ends up happening is that is taken and that is put into a working form by the EMS medical direction for each community. What that is either a hospital or a physician group that has taken on the giving of orders to the EMS personnel. EMS personnel cannot function independently of a physician. Now, we are not with a physician when we do the things we do, but we are doing the things we do because we have been given permission to do it. We are doing it under the orders of that physician. Those orders can be two different styles. There are online medical direction orders and offline medical direction orders. Online medical direction orders, those require you to actually contact the physician's group or the hospital in order to get guidance for that specific thing, or in order to get permission for that specific thing. Offline orders are a written kind of grouping of here's what you can do on each individual type of call that the medical director will create. That is used the majority of the time out there in the field. We take that standing orders, as they're called, and we apply them day in and day out to every patient that we see. There's a standing order for a patient with chest pain. There's a standing order for a patient with respiratory distress. You name it, there's an order for it. The only time you have to move over and make a phone call and use the online type of medical direction is if the standing order has said, in this situation, contact medical control. Now, you'll hear some terms used interchangeably in reference to offline medical control. You'll hear my protocol. You'll hear my standing orders. They are the same thing. Protocol, standing orders, offline medical control, those three terms can be used pretty much interchangeably. In order to make sure that all of the EMS providers are doing what they should be doing out there and actually following these standing orders, we've got something called continuous quality improvement, or quality improvement that's done throughout the states. Now, this is done a lot of times at the local level or at the medical director level, where the runs that EMS providers go on are critiqued. Now, that's usually through reading the final run report that the provider makes after the patient encounter. You may have the medical director involved in this. You may have the fire department or the company representatives involved in this. And you may have a group of peers that are involved in this, where they read through these reports and they look to make sure that the orders are being followed and that the calls are going the way they should be, and that there's not any issues with patient care or performance from the EMTs, EMT advances, or paramedics. Now, this is not designed for punishment. This is designed to make the system better and to ensure that everybody's doing what they should be doing out there. Now, that does not mean that there will not be consequences if during continuous quality improvement it comes up that maybe there was a mistake made or an error made or something like that. There can be consequences to that, but the intent is to make this better. Um, Through this process, also, the entirety of the report is usually looked at to make sure that the providers are putting in all the right information in the right areas of the report. And we'll have a whole chapter on documentation, but there is a lot more to a run report than just the patient care. And the continuous quality improvement aspect of it is designed to make sure that all of that is being done properly. Now, one of the things that we've move towards in EMS is the implementation of evidence based practices. This wasn't always the case. There was a lot of EMS care over the years that was the result of a lot of opinion. Now, they were educated opinions, but there wasn't a lot of data behind a lot of what we did. And so there's been a push recently to move towards a model that everything we do is driven by data. And is this really working? Is this not working? Is this detrimental? So that is something that has resulted in a change in protocols or standing orders routinely. But that's a good thing. If we're doing something and evidence suggests that it's not working, we're going to get it out of there and try to find something that is working. Now, there's a process to this type of thing. Doing studies, going through studies, getting multiple physicians together, getting multiple groups together, getting everybody on the same page. There's always a bit of a pushback with change. It is what it is, it's human nature. But we've got to keep on this path of doing the things because they really are doing what we think they're doing. An evidence based approach is the only way to kind of prove that. So, where are we going from here? Well, you're starting to see a push towards what's known as community paramedicine, uh, mobile integrated healthcare. What these are designed to do are to find the problems in the systems and try to find some solutions that EMS can bring to the table. Now, when we say problems, a lot of it has to do with there is still a large segment of the communities in the United States that don't have good access to healthcare. The result of that is that these communities tend to use the emergency services and emergency rooms as their healthcare, period. And so, what somebody would go to a doctor's office for, a lot of these areas are finding these folks are going to the emergency room for. So, how do we, as EMS providers, contribute to helping in this type of situation? Well, what community based paramedicine does is put EMS responders out there into the communities to take a proactive approach to helping these patients find the right care for the things that are wrong with them. It could be a system that allows you to routinely check in on these folks when they do activate the 911 system, and it's obvious to the call taker and the dispatcher that what they're calling for is not truly an emergency. We are able to send a community paramedic unit to them that is not a transporting unit so that we can keep a transporting unit free to then go on a true emergency. So that's just one version of what some of this looks like. So now let's get into the last section of this chapter, and that's EMS's role in public health. Now, when we talk about public health, we're not talking about individual patients here. We're talking about public health in general. Things like control of infectious disease, making motor vehicle safety a priority, vaccination programs. EMS plays a big role in this. Since we are essentially on the front lines of healthcare, we are in a unique position to take a proactive approach to finding problems within the community and coming up with some solutions. Proactive is the key word here. Prevention, education, wellness. EMS can identify risks in sensitive populations such as victims of human trafficking, children, and the elderly, and come up with solutions to help prevent disease and disability. One of the ways that we can affect change is by getting into the schools and promoting education, taking an approach of getting into the schools, talking with the kids, talking with elderly groups, and trying to come up with innovative ways to prevent injury and illness. Well, that's everything for Chapter 1. Those of you that are in EMT school, your journey is just beginning. Those of you that are watching this and just curious about what EMS is, I hope you learned something. And if you like this kind of content, check us out at gritcityacademy.com. And stay tuned, because there's a lot more coming. Grit City Fire and EMS Training, Youngstown, Ohio.